Michael, give us an update on the state of admissions and what kind of capacity you're at.
Oh, thank you. I'm delighted to be with you again. We're in pretty good shape at the moment. The numbers have increased. We today have about 730 patients in our hospitals, COVID patients. And that has increased pretty dramatically over the last 3 weeks. But let's put it in context. Back in April, when we were at the epicenter, we had on a daily basis 3,500 patients in our hospitals. So 730, while it is an increase, is very, very manageable. We have the capacity, we have the supplies, we have the staff. And I assume, and we all assume, that it will increase some more. And when it does, we are ready. We will be able to manage this. It hasn't caused any major disruption to the rest of our organization at this point. And that's pretty much what's happening definitely in this part of the state. All of the hospitals have been very, very resilient and very competent in being able to manage this. And we're in a much better shape today than we were back in March and the beginning of April. So we are ready for this, and we will handle whatever is thrown at us and do it confidently.
You have 23 hospitals, more than 700 outpatient facilities, and I should mention that it's everywhere from Long Island to Westchester, so a pretty broad reach. This advice from Governor Cuomo that may originally have come from you, that hospitals may need to increase their capacity by 25%. Do you anticipate that being a necessity for Northwell?
Well, we have the ability to, increase our capacity by over 50%. We did that before. All of the hospitals are planning to increase the bed capacity. We have the ability to increase ICU capacity. So I don't see that as an issue. If the numbers really increase, then obviously you have to deal with staffing issues. That is always the most difficult. The bed issue is not as big a problem as many people often think it is. But yes, we have plans to increase. We have very, very detailed plans on how it is we can react depending upon what the level of the increases are on a regular weekly basis. So I would just say to the public, we're able to handle this. We will handle it, and we will do it well. And we'll have to adjust, obviously, as time goes on, because things change. And as things change, you have to adjust carefully. But we're able to do it, and we're in control at the moment.
Now, you employ more than 74,000 employees, obviously support staff as well as frontline staff. Some of those would have gone to other states when other states saw surges. What do you anticipate you'll need from other states if we see a continued surge here in New York?
Well, we have entered into an agreement. I mean, Northwell has entered into a reciprocal agreement with other health systems around the country. And we have this agreement that if they're in trouble, we help them. If we're in trouble, they help us. So, in fact, yesterday, I sent 15 staff to the Henry Ford Health System in Detroit because they are having a bit of an issue, and the CEO reached out to me. And per our agreement, 15 of our people are now in Detroit helping them. They will be there for about 2 weeks. And if we get into a situation where we need help and they are able to do it at the time, it all depends on the local circumstance as to whether or not people are able to share staff with others. But there is a common interest here. We all are willing to help one another. We've learned an awful lot over the last 6 to 9 months. And so I don't anticipate at the moment that we will need to be getting staff from out of state. If that does happen and that need does arise, then we will be able to activate it at that time if necessary.
That's pretty amazing. It must be difficult making those decisions as to who goes and who stays. Michael, I want you to have a listen to just a little sound from Governor Cuomo this morning.
The system wasn't overwhelmed. Individual hospitals were overwhelmed. And the individual hospital was a silo. So they showed up at one hospital that, by the way, had a sister hospital over here and a sister hospital over here. And rather than sending people to the sister hospitals, they just sat there and got overwhelmed.
So this goes to triage. How have you changed plans in terms of triaging people or in terms of bringing people to the right hospital with the right capacity? Has that improved, Michael?
Well, we were the first to do this at Northwell. This is called load balancing. So if one hospital gets overwhelmed, then you move the patients to another hospital that has the capacity. We actually, in April, during the height of the problem back in April, we moved 800 patients from the Queens area, from our hospitals in that geography, to other hospitals across the system. So what the governor was talking about was that not everybody did this. And there were, at the very beginning, a couple of hospitals that got overwhelmed, not at Northwell, but in other places. And of course, back then, it was new. It was unique. We hadn't experienced it before like this. So we all learned. So everybody right now is fully competent and capable and aware of the fact that they have to load balance. That's what the governor was talking about. And I don't believe that we will run into the problem now or in the future that we ran into back at the beginning of April. It's a smart thing to do. It's the right thing to do. It's easy to do when you have a large health system with multiple hospitals in it. But it is the appropriate reaction when you have a problem like that, so that no one place gets completely overwhelmed. That makes no sense at all. But right now we're well prepared for it and ready.
Michael, I don't want to just throw numbers out there for no reason, but Scott Gottlieb did mention at least 300,000 and very possibly 400,000 deaths after the holiday period. Do you have a number in mind as to what would be the worst case scenario?
No, I don't. You know, Scott is a pretty, intelligent individual on these issues. I think what we worry about is the holiday season now. And as we go into Christmas, I do believe that we're going to see an increase subsequent to Christmas. And I believe that Dr. Fauci even said this morning, that probably what we have to prepare for is a real increase in hospitalizations a week or two after the Christmas holiday season. What the numbers will actually be in real time, I can't say. Projections, I think, are something I try to stay away from, other than being completely prepared for whatever happens. If it's large, we will deal with it. And the mortality rate, at least in our area, seems to be decreasing overall relative to what it was back in April, because we have many more treatment methodologies today. We can handle the patients better today. The patients are getting a little bit younger overall. But, any one death is a death too many. And so what we try to do, to the best of our ability, is reduce that possibility that somebody will pass from COVID. It does happen, unfortunately, but we do our best to make sure that it is as minimal as possible.
Michael, on a brighter note, we are likely to get a vaccine soon, and obviously first responders will be among the very first in line to get it. Do you have a plan for executing vaccinations across your system? Do you have delivery of those vaccines yet?
Yeah, well, with regard to the plan, we have a very detailed plan as to how to do this. We've been working on this for quite a while. It's been no surprise now for a couple of months that the vaccine would be available sometime around this period. So we have a very detailed plan. We expect to get our first tranche of vaccines next week, around the 15th of December. We don't have yet a definitive number as to what it is we will get. And there is still some debate about priorities, although nursing homes, obviously, which is being done in New York State by the federal government, the state opted to go for the federal program. So they will be getting the vaccines first. And then healthcare workers, such as intensive care workers, ICU workers, emergency room and emergency department workers, they will be the priorities. And that'll be in the first tranche. And then, of course, there will be multiple ones after that. This is going to happen slowly. It's a little confusing at the moment because there's many different directives coming out. It will all get clarified over the next 7 days or so. So what we have to do on the operational side is to manage the confusion with confidence. That's what you do, and not everything is always exactly clear. But I think what people have to understand is that the rollout of the vaccination process will be multiple months. This will go on for months, and there'll be different priorities. The first one, as I just mentioned, and there'll be a second one, a third one, a fourth one. And it's a little complicated, but we will be able to handle it pretty well, I believe.